Hey, it's Chris with Rowe Dental Laboratory, and today I want to highlight this little book we've been working on for a while to make your lives way easier when it comes to full arch restorations and how to get them done. This is the Ultimate Restorative Protocol Guide. Now, in this guide, it has all the different workflows, analog and digital, as to how to get to your prototype or your printed try-in and then your final fixed prosthesis. And then it has the different scenarios. So as the patient, how do they present when they come into your office? Now, we've put together, there are 4 patient scenarios in the full arch world as to how they can walk through your doors. And just in the first page here, we have, first couple pages, we have them listed here. It's the patient walks in with just implants placed, and there's healing caps on the implants. They could come in with implants and multi-unit abutments seated already with healing caps, or they could walk through your doors with implants and the fixed prosthesis is their temporary, and you have to get them into their prototype and then final. And then the last scenario is an overdenture that you want to convert to a fixed. Now, there's challenges with all these, and we're going to kind of go through some of those challenges. In this scenario, the patient is walking into your office. They have an overdenture, and they want to get rid of this thing. They don't like the palate. They want to be able to taste their food, and they don't want this thing moving around. So let's get them to a fixed prosthesis. Now, this is probably the longer of most of the scenarios as far as getting them into their final fixed prosthesis. There's analog workflows, there's digital workflows, all listed in here. Some of the challenges with this are we have to have a new prosthesis made to either be converted or there's other workflows as well, but you got to have another prosthesis made. We have to reestablish vertical, establish passivity. So that can be done, again, digital or analog workflows. Usually to establish passivity, we'll do a verification jig with that. And ideally, we have analog records for that. There's great digital workflows out there, but the most cost-effective to establish passivity is the analog record at multi-unit abutment level or implant level. And that's also another challenge with this is we have to get that patient out of their bar, so it's a bar overdenture, or get them out of their locators, and then we have to choose what multi-unit abutments are ideal. So we can help you out with that here at the lab, or you can choose them yourself and get those seated, and then again, multi-unit abutment level impressions. So this one's a little more complicated, but don't worry, we got you covered here in this book, and then ultimately we'll get you into a printed try-in and full arched fixed finals. So there's a ton of great workflows in this. Again, digital and analog, we got you covered no matter what the patient scenario is. You can download this from our website in an ebook version, or we can send you a physical version as well. Please give us a call with any questions here at the lab. Follow us on our socials. We have some great information on there on not just full arch, but everything in the lab world. And we look forward to working with you on your next full arch case. Thank you.